Okay, today we're going to go over some of the key concepts of body mechanics. We're going to talk about some transfer devices, some supports and padding that are used in our exams, as well as the importance of side rails. Okay, when it comes to the principles, that's a key word there, principles of body mechanics, we must consider alignment, movement, and balance. All right, in order to use proper body mechanics, and to help reduce the risk of injury and conserve energy and avoid any undue stress and strains to your body. The principles of body mechanics include alignment, movement, and balance. Okay? Think about an athlete and how in many sports it's very evident that balance and that movement and alignment is what really contributes to the abilities of athletes being able to perform the amazing different feats that they do. When we look at three concepts of body mechanics, we talk about the base of support, so that's the stability of the body position itself. We talk about the center of gravity. Okay, the center of gravity is in your pelvis area, your hip and pelvis area. We look at, again too, if we compare it to say athletes per se, somebody being hard to push off the puck or a figure skater, things like that. That center of gravity is what they're referring to there. The line of gravity is the vertical line that passes through the center of the gravity. All right. There are in your textbook. There's pictures of what the illustrations of what the base of support is, the center of gravity, and the line of gravity. So have a look at that. Common body positions in healthcare. All right. So we are talking about the Sims position. All right, again too, that is similar or can be compared to some extent the lateral recumbent or the recovery position. Keep in mind when we talk about lateral recumbent, it could be a left lateral recumbent or a right lateral recumbent. But lateral recumbent means the patient is lying on their side versus on their back. Then we have the Trendelenburg, where the head is approximately 15 degrees lower than the feet. That's a very important body position, particularly when a patient is experiencing what we consider different types of medical emergencies. We want to tip the head a few degrees lower than the feet so that we bring the blood back into the area where the vital organs are, such as the head and the blood pressure. And that's why on the stretcher you will have that feature to put the patient in the Trendelenburg position. Okay, for many reasons, but that's one of the reasons, if there was a medical situation that required the patient's head be lower than their feet. We have the Fowler's position, and that's where the body is inclined close to 90 degrees, so you're basically sitting up nice and straight in a stretcher, okay, with the head elevated completely. You have your semi-Fowler's position, where it's more of a 30 to 45 degree angulation of the head. And then finally we have your prone position, where the patient's lying on their stomach, versus a supine position where the patient's lying on their back. When it comes to transferring patients, we do use different types of devices. Something so simple as a sheet. So for instance, we use that long flat sheet that is the top layer, or one of the top layers of the sheets that cover the stretcher themselves. We use slider boards. They come in different types of shapes and sizes. We use lifts or surgical lifts. We use walkers, as well as we use the transfer belt or the gait belt. Okay, all right. When we are looking at the types of patients that will require transfers in the department, we're going to go in more detail about these type of patients, but an overview of them would be a stroke patient who's experienced some paralysis, perhaps a patient with a lower leg injury, so a fractured tib fib or knee or something along the lines. And then we have those patients who have had knee or hip replacements as well. Okay, trauma patients, those would include spinal injury patients, post-op, so patients who have had surgery. It could be anywhere, but typically it's the thoracic or the abdominal cavity. And then we have our patients who are paralyzed or somehow their mobility is decreased. So those are some of the patients that are consistently requiring different types of transfers, but that's okay because we have many different methods and practices to assist and tailor that transfer based on those patients' needs and what's required. So when we are looking at having the patients transferred, we want to make sure when we're talking about supports and padding that the patient is comfortable. Okay, we need to have those patients in the correct position in order to obtain the x-ray. And so in order to assist with that, we provide these radiolucent sponges. And these sponges come in many shapes and sizes. Okay, they're also come in different, I would say, firmness. It's sort of like a bed mattress, right? Some are softer and some are firmer and things like that. We also to have these protective covers, or we makeshift these protective covers for these sponges. We'll put pillowcases or saran wrap or different things over top, because these sponges have a tendency to be porous, so they would absorb body fluids such as blood and urine and things like that. So the main characteristic is that these are radiolucent, which means they won't show up on the x-ray, but we have to be conscientious when we're using them as far as making sure that they are protected, because they are able to be laundered. However, you know, it's a bit of a process when we throw these sponges in the laundry. Sometimes we get them back, sometimes we don't. Sometimes when they do come back, they're all misshaped and they're not really as functional as they have been in the past. So we do like to protect them to begin with. When we are using sponges and you know, if we're elevating, say for instance, a patient's head or what have you, we want to ensure that the patient is part of the exam. So comfort is one thing, as well as decreasing apprehension, and that's important, and it takes very little time and effort, because once a patient has that sense of trust and you've invested in building that rapport, that increases cooperation. And the cooperation is a huge part in the success of the exam. Some of the images we obtain can be challenging, especially based on the patient's injury or illness, and so we need to be very creative and adaptive and kind when we are using these different types of sponges and supports in order to make the outcome of those images as diagnostic as possible. Okay, that really is one of our primary roles, and these sponges are excellent tools in helping us to achieve that goal. We also too want to keep in mind that these sponges and these paddings help to prevent the development of ulcers or bed sores, especially in patients who are debilitated or the elderly patients, because some of the exams or procedures we do perform in the diagnostic imaging department can take anywhere from a half hour to 60 minutes. And that being the case, if you do have a patient who has mobility issues and they're in the same position for an extended period of time, ulcers can occur, and that is not something that we want to occur, because we are aware of that and we can avoid it by and should make any effort and attempt to avoid those. Bolsters help too. Bolsters are a little different than sponges. They're larger. They're added. Their firmness is quite a bit more, and their main and primary purpose is to help relieve the lumbosacral stress by having the knees bent up. Okay, so when patients are lying flat on their back, it tends to put a lot of strain on the lower back, so we put these bolsters underneath them with their knees bent up, and that helps to really alleviate some of that strain or that stress. And again, to comfort equals cooperation, which equals good x-rays. All right, we are looking at those patients who are particularly arthritic, or they have kyphosis, or perhaps they have had some surgery done, particularly in the abdominal cavity, and there's a lot of strain on the surgical site and that sort of thing. So the bolsters, again, to help to comfort the patient and provide us with the opportunity to perform these exams. Ulcers do commonly form on the sacrum, okay, the heels of the feet, the elbows, the trochanters if the patient's lying in the lateral position for too long. There are different types of, I guess you'd say, sponges or padding that we can put underneath there, so take the time and effort to do so. When we're looking at bolsters themselves, they or the use of them or what have you, they do help when it comes to reducing these ulcers. Okay, and these the different phases of the skin breakdown. We do have two different phases of the skin breakdown. One is ischemia, the other one's reactive hyperemia. So please become familiar with those different types of skin breakdowns, or those two phases, of skin breakdown, and how that can be prevented. And that's with the use of supports and padding. Side rails. Okay, so side rails, there are going to be different kind of mechanisms on each of the side rails to raise and lower the side rails. Please become familiar and take the time to understand how some of these side rails work. Some of the side rails go straight down, some of them come straight, go out a little bit, etc., like this and that. So we want to make sure that you're familiar with these side rails. As far as who requires side rails, anytime a patient's in a stretcher, keep the side rails up until you're actually going to transfer them and you need the side rails down. Please just keep the side rails up because you don't know what sort of state that patient could be in. All right, they could be cognitive, they could seem to be cooperative, and then the side rails down, and then all of a sudden we find them on the floor. So we want to be a bit more mindful of the patients who particularly have an altered state of consciousness or could be impaired, and those would be a patient who has been sedated or is on pain medication. Okay, perhaps the patient is under some sort of influence or intoxicated. Also a patient who is in shock. And we're going to talk a lot about shock next semester, but a patient who is shocked should always have the side rails up. And we are also looking at someone who perhaps has a decrease in the awareness of their surroundings, or perhaps, Alzheimer's, dementia, patients who seem to not quite understand the safety element of it. So it's always just good practice. Keep the side rails up. Okay? All right. So that kind of in summary, we look at the use and the effectiveness of using sponges and different types of padding. We keep in mind that even simple devices such as sheets are used in transferring patients. It's important to note the different body positions and when particularly we'd use those body positions. And then of course the main concepts when it comes to body mechanics are the principles and the concepts. Okay, thank you very much.